8 warning signs of stroke in women. Strokes are serious medical emergencies that can happen to anyone, but did you know that women have unique risk factors? Women often experience unique stroke symptoms compared to men, making it even more vital to recognize the warning signs early. A stroke occurs when the blood supply to part of the brain is blocked or when a blood vessel in the brain bursts. This can lead to brain damage, disability, or even death if not treated immediately. Let's dive into the 8 warning signs of stroke in women that you absolutely shouldn't ignore. Quick reminder, we're not doctors. This video is for information purposes only. Number 1. Vision problems. Sudden vision problems are a significant warning sign of stroke. Women might experience blurred vision, double vision, or even complete loss of vision in one or both eyes. This can happen because a stroke may affect the part of the brain responsible for your vision. It's easy to brush off as a temporary issue, but it's crucial not to dismiss it. For example, you might be sitting at your desk and suddenly your sight in one eye goes blurry, or you might see double when looking at your phone. In addition, you could be reading a book and suddenly the words become blurry. You might also find it challenging to see out of one eye while the other remains unaffected. These abrupt changes in your vision should send off an alarm bell and you should seek immediate medical attention. Number 2. Sudden weakness in the face, arms, or legs. Experiencing sudden weakness or numbness, especially on one side of the body, is a classic stroke sign. This can affect your face, arms, or legs and may come on very suddenly, making it difficult to perform everyday activities. For instance, you could be going about your day and out of nowhere, you find that you cannot lift one arm or leg properly, or that your face feels droopy on one side. A sudden inability to smile symmetrically, or even to grip objects with one hand, can also be an indicator. This isn't just a minor inconvenience, it's a signal that something serious is happening inside your body. The unexpected loss of strength can be alarming and should prompt you to seek medical help. Don't wait to see if it passes. Call 911 immediately. Moving on to our next warning sign. Number 3. Sudden changes in behavior or confusion. When a stroke occurs, it can disrupt the brain's normal functions, leading to abrupt changes in how you act or think. In an instant, you might become very confused, having trouble speaking, thinking, remembering things, or struggling to understand what's happening around you. These symptoms can sometimes be mistaken for other conditions, so it's important to recognize the sudden onset and circumstances. You could be chatting with someone, and out of the blue, you start having trouble following the conversation. You might say things that don't make sense or you may seem disoriented. This sudden confusion is not normal. Another example could be, if a usually calm and collected friend starts acting out of character just like that, perhaps becoming agitated or unable to concentrate. They might not recognize familiar places or people, or have difficulty making simple decisions. These abrupt changes in behavior and mental clarity are red flags. Number 4. Severe headache with no clear cause. One of the lesser-known but crucial warning signs of a stroke is an instant, severe headache that comes out of nowhere. In many cases, this is caused by bleeding in the brain or a blocked blood vessel. For women, understanding this symptom can be life-saving. This type of headache isn't your typical headache. The pain might be more intense than any headache you've experienced before and is often described as the worst headache of someone's life and can come on without warning. For example, you could be going about your day when you're suddenly struck with an intense, debilitating headache that feels different from a typical migraine or tension headache. On the other hand, you could be having coffee with a friend, and she unexpectedly clutches her head and describes a pain that's unlike anything she's felt before. This isn't the time to wait and see if it goes away. A severe headache like this, especially when it appears without any obvious reason, needs immediate medical attention. Number 5. Now let's take a look at a symptom you might not expect: hiccups. Hiccups are those annoying, involuntary contractions of the diaphragm that we all experience from time to time. They can be triggered by a variety of factors, from eating too quickly to drinking carbonated beverages. I know you might be thinking, hiccups? Seriously? But persistent hiccups, especially in women, can be a hint that something is wrong. While most hiccups are harmless and go away on their own, those that last more than 48 hours can be particularly concerning. They can be a sign of a stroke, especially when they occur suddenly and are accompanied by other symptoms. And get this, a stroke can disrupt the brain's normal function, including the areas that control things like breathing and muscle control. When these areas are affected, it can lead to involuntary spasms of the diaphragm that we know as hiccups. Let's say you're with a friend and one of you unexpectedly starts hiccuping nonstop. At first, it might seem amusing, but if it persists along with other symptoms, it's crucial to act quickly. Next, number 6, nausea and vomiting. When we think of stroke symptoms, nausea or vomiting might not be the first things that come to mind. However, for women, these can be crucial warning signs. The brainstem controls many automatic functions in the body. This includes heart rate, breathing, and the control of nausea and vomiting. When a stroke affects the brainstem, it can disrupt these functions, leading to sudden nausea and vomiting. Not only that, any significant disruption in normal brain function, which happens during a stroke, can lead to various symptoms, including gastrointestinal ones like nausea and vomiting. The brain's communication with the stomach and digestive system can become erratic and cause these symptoms. For instance, you might be out to lunch with a friend and she immediately turns pale and starts feeling very sick to her stomach. She might need to sit down, and you notice she's also experiencing other symptoms like dizziness or trouble speaking. These are clear signals that something serious is happening. Moving on to number 7, extreme fatigue. Feeling overwhelmingly tired or fatigued without an obvious reason can be a warning sign of a stroke. This fatigue can be sudden and more intense than normal tiredness, making it hard to stay awake or function normally. Extreme fatigue can happen because a stroke disrupts the brain's normal functions, affecting energy levels and causing sudden, unexplained exhaustion. This symptom can be easily overlooked or mistaken for something less serious, but it's important to recognize it as a potential warning sign of a stroke. For example, all of a sudden you might feel an urgent need to lie down and rest, even if you haven't done anything strenuous. This fatigue can come on rapidly and can make it difficult to keep your eyes open or stay alert. This isn't just being sleepy, it's an intense fatigue that feels different from normal tiredness. Number 8, difficulty walking, dizziness, loss of balance or coordination. Finding it hard to walk, feeling dizzy, or losing balance and coordination just out of the blue can be indicators of a stroke. This can be displayed as a feeling of heaviness or a complete inability to move a limb. These symptoms are due to disruptions in the brain's control over movement and coordination leading to these sudden changes. Women experiencing a stroke might feel like the room is spinning or find it difficult to walk in a straight line. This loss of balance and coordination can come on very quickly and is a clear sign that something is seriously wrong. As an example, you might find yourself stumbling, feeling unsteady, or needing to hold on to something for support. This unexpected loss of balance or coordination can also make it challenging to perform even simple movements. So, if you experience sudden dizziness, finding it hard to walk, or losing balance, don't wait it out. Get checked out by a medical professional immediately. Let's explore some unique stroke risk factors for women. Women face specific risks that can make a stroke more likely. A health-related condition such as high blood pressure is a major factor, and it's even more common in women, especially after menopause. Additionally, women with diabetes are at higher risk because diabetes can damage blood vessels, making a stroke more likely. Other important factors include heart disease, smoking, and using certain kinds of hormonal birth control pills or hormone replacement therapy. On top of that, menopause and pregnancy can also significantly impact stroke risk for women. Blood clots happen more often during pregnancy, and complications like preeclampsia and gestational hypertension can lead to high blood pressure. This can increase the risk of brain bleeding, which can cause strokes. If you notice any of these symptoms in yourself or someone else, act fast. Use the acronym BE-FAST to remember what to do. Here's what they mean. Balance. Observe if the person is off balance. Eyes. Find out if there is any change in eyesight, such as double vision or blurring. Face. Look at the person's face. Check for drooping on one side. Arms. Ask the person to raise both arms. Is one arm weak or drifts downward? Speech. Ask the person to repeat a simple sentence. Listen for slurred or strange speech. Time. If you see any of these signs, call 911 immediately. Time is critical. Stroke can happen to anyone, no matter their age or health status. Remember that the symptoms can differ from person to person. So if you notice any of these symptoms, especially when accompanied by other neurological changes, don't wait to see if it goes away. Head to the nearest emergency room immediately, because every minute counts. The faster you get medical help, the better your chances of minimizing brain damage. This can be the difference between life and death, or between a full recovery and long-term disability. And there you have it, 8 critical warning signs of stroke in women that you should always take seriously. We hope this video has been informative. If you found it helpful, hit the like button. Please remember to comment, share, and subscribe for more. Until next time, take care of yourself and each other.